Google's Chief Health Officer, Dr. Michael Howell.
On behalf of everyone who works on health across Google, welcome to the Checkup 2026. I'm Michael Howell, Google's Chief Health Officer. Today is all about how we're bringing the full force of Google to health. And as we get started, I find that I am filled with optimism. I've been at Google since 2017. But for more than 20 years before that, I took care of patients, mostly in an ICU. And ICU doctors, we're not naturally optimistic. We take care of people on the worst day of their life. And we get to be part of saving many, which is amazing. But also we feel in our bones how fragile things can be. And so when I tell you that I am optimistic, that means something to me. And I think that by the end of the checkup, you'll be optimistic too. At Google, we've been working on health and AI for more than a decade. 2026 is the 10th anniversary of our work detecting one of the most common causes of preventable blindness in the world. Back in 2016, this groundbreaking work felt like seeing around the corner, a preview of what the future might hold. In 2026, that future has arrived. As somebody who carried a pager and spent a lot of time with fax machines, one of the most exciting things about this moment is that healthcare is at the forefront of the AI movement. It's no longer just about the future. It's about right now. Today, we're going to explore what that means across 3 areas: finding answers when you need them, supporting clinicians, and fueling the cures of the future. First, finding answers. You'll hear how Search, Gemini, and YouTube are using AI to help people navigate complex, nuanced health questions, and then to use that knowledge to take action on their health. We'll share how the US Centers for Medicare and Medicaid Services is empowering people with their own health data. And you'll hear how Fitbit's health coach is helping people take action on their health and to really improve where it matters. When it comes to health, we're meeting people where they are, and we're also helping people get to where they want to be. Second, supporting clinicians in a few specific ways. First, at the bedside. Keeping up with research is a challenge. Health systems deal with this by summarizing hundreds of studies and guidelines into clinical pathways. But if this life-saving information is buried in PDFs and locked up in binders, it may not reach patients. Seattle Children's Hospital used Vertex AI and Gemini models to help build their pathway assistant, which helps clinicians get the exact information they need exactly when they need it. The right information at the right time can help save lives. And this is just as true for one patient as it is for many. You'll hear later today how Taiwan is using AI to improve diabetes care on a population-wide scale. There's also a deep need for supporting clinicians in rural healthcare, where communities often face the greatest barriers to access. I know this from statistics, but also from life. This is my granddad's barn in Alabama that I spent a lot of time in and around growing up. To address this gap, we're exploring work with leaders in Arkansas, including the Alice Walton School of Medicine and the Heartland Whole Health Institute, to help pioneer a model for rural health transformation. Together, we'll focus on clinician education, care delivery, and health research using AI initiatives aimed at improving the accessibility of care and also improving health outcomes. At Google, we're also thinking about how clinicians learn and train. I spent many years teaching at the bedside. Today's trainees will be the first generation to practice in a world transformed by AI. Our students, our residents, our fellows are the future. We need to invest in getting that right. And that's why I'm really proud to share that Google.org is committing $10 billion to fund organizations that will collaborate to reimagine clinical education in the AI era. The goal? To improve high-quality, person-centered care. Leading the way, the Council of Medical Specialty Societies and the American Academy of Nursing are the first of 2 organizations that will help support this work. Finally, AI is fueling the cures of the future. Today, you'll hear about truly transformative AI discoveries across Google Research and Google DeepMind, from understanding the molecular biology of disease with Deep Somatic, to research we shared last week about how AI may improve breast cancer detection in the UK, to predicting life-threatening weather events with Google's Earth AI. Over the past decade, we've helped establish an evidence base for what actually works in AI and health. And last month, in partnership with Included Health, we announced a forthcoming randomized controlled trial about AI in real-world virtual care to help continue building the evidence base that the field needs. All of this can be summed up as help for today, hope for tomorrow. AI is already helping people understand their own health and take action to improve it. It's supporting clinicians at the bedside and the trainees who are the doctors and nurses of the future. And it's transforming the research process, helping scientists discover the next generation of cures faster than ever. To get us started with how search is helping billions of people navigate questions about their own health, here's Hema.
Hi everyone, I'm Hema, and I lead AI quality and experiences on Google Search. Search is one of the first places people turn to when you have health questions, be it for yourselves or for your loved ones. In fact, every day, people bring over 1 billion health questions to Google. That is 1 billion health questions every day. And these could be about understanding symptoms, about nutrition, about navigating care, and more. Last year, at the checkup, I talked about how we are transforming search with AI overviews. They made search even more helpful and opened the door for users to ask more complex questions. But one thing we recognized is that people wanted more end-to-end AI experiences, something that actually enables conversation. That's why we introduced AI Mode. It's one of our most powerful AI searches. Like, it's got a deep connection to the web, something that you expect from our search engine, and the ability to turn from questions into a conversation. AI Mode is available in more than 90 languages and in more than 200 countries. Now, people all over the world can ask whatever's on their mind, no matter how long or complex or nuanced, and get a helpful AI-powered response with links to the web to learn more. And we made the transition from asking just questions to having a back and forth conversation that is more seamless. Now, users can ask a follow-up question right from AI Overview, jump into a back and forth with AI Mode. These experiences use our Gemini 3 models. Built for intelligence and speed, Gemini 3 brings incredible reasoning, tool use, and multimodal capabilities to tackle your most complicated health questions. Here's an interesting insight, right? Search queries have gotten 3 times longer. So people are actually asking detailed, specific questions with the nuance and context that health requires. So instead of just typing a keyword, insomnia, now we get a question that is more on the lines like, I am wide awake at 4 a.m. again and just can't get back to sleep. Why does this keep happening? And are there any tips so that I'm not a zombie tomorrow? People are also asking follow-up questions and even revisiting the past conversations as they learn about conditions and complex topics, like continuing to explore diet options for prediabetes. It is now easier than ever to search in ways beyond text. You can use your voice, share an image or a file, or even use your camera to ask a question. That's especially helpful when it comes to health. Let's say you're struggling to make sense of this lab report, which is sometimes hard to understand. Simply upload your lab report into AI mode to learn what this information means. It'll explain things like your red blood cell count, your hematocrit levels, your hemoglobin levels, and even actually create helpful follow-up questions to bring to your doctor. This is a much more intuitive way to get the information that you need to navigate, right? Now, search has always been the go-to destination for health information. With AI mode, it is even easier to understand symptoms and build on what you learn and have a conversation with your practitioner. We take this responsibility seriously. We are constantly evaluating and improving the quality of our responses. To do that, we align our models with clinical guidelines and stress test their reasoning, tone, and their grounding in quality resources. Reliable information starts with authoritative sources. That's what has always been at the heart of our work at Google Search. Because health information varies by country, we want to bring the most relevant, locally nuanced, country-specific information to people around the world. That's why we work with world-class institutions like Apollo and Tata 1mg in India and Medical Note in Japan to supercharge responses with trusted sources. I deeply, deeply believe that technology has to be a force for good. As AI transforms how we approach health, we are continuously innovating to turn AI advancements into real-world impact for billions of people. Now, here's Joel on how Gemini can help put this knowledge into action. Thank you.
Thank you, Hema. Hi, everyone. I'm Joel from Google DeepMind, and I lead research teams dedicated to building AI to benefit humanity. Today, I'm excited to share the work from a few teams across Google that are empowering patients, caregivers, and researchers to fundamentally improve the landscape of care. As Hema mentioned, we've already set high standards for health information on search. And the Gemini era allows us to go further, helping people find and synthesize information at a personal level. Many people today are already turning to Gemini for health answers. But access to care remains a challenge as caregiver shortages grow. To truly support patients, we must first support the people who care for them. Let's take an example. Japan, one of the most advanced aging societies, is projecting a shortage of nearly 600,000 healthcare workers by 2040. Caregivers tell us that the biggest hurdle isn't elderly care itself. It's documentation, which consumes up to 20% of their work hours and drives high staff turnover. Does this sound familiar? To help caregivers reclaim this time, we turn to gems in the Gemini app. Gems are saved, specialized instructions that customize Gemini for specific tasks, so it understands your needs every time you use it. Our team developed a gem specifically for the Japanese market, where caregivers can upload voice memos, text, or even handwritten notes. Gemini then transforms them into standardized professional records. They can be translated into numerous languages for rotating caregivers for whom Japanese may not be the native language. All records are protected with enterprise-grade security to ensure data stays within the provider's organization and is never used to train our models. This gem will be available to our work-based customers in Japan later this month. We believe technology should serve you and not the other way around. By streamlining these administrative tasks, we aim to protect caregivers' time for what truly matters, the human care that only they can deliver. Now, supporting caregivers is only half of the equation. We also want to empower patients by meeting them exactly where they are. Gemini has become an always-on, accessible resource, from supporting a user's daily wellness journey to helping prepare for an upcoming appointment. See, the other morning, I woke up with pain in my knee. I turned to Gemini to help me understand my symptoms and what action I should take. When it became clear that I needed to see the doctor, Gemini helped me prep for my appointment, identify the specific symptoms I should mention, and the questions I should ask. After my visit, I received my follow-up report, and I found myself with a whole set of questions. I snapped a picture of the report, uploaded it to Gemini, and I'm more comfortable in my native language when it comes to health, so I asked Gemini to translate it. Having Gemini as a resource gave me a deeper understanding of my situation, and most importantly, the confidence to walk into my next appointment having followed the advice from my doctor. Now, I'd like to share a story from my colleague, Michelle, and how Gemini supported her through every step of her health journey.
For the last 2 years, I'd come home from the office feeling so wrecked. I'd had this crushing fatigue and intense headaches that started in the back of my left eye and zero energy to actually be present with my family. Finally, last November, I remember coming home from work and I was completely debilitated. I opened up Gemini app and I started chatting with it. Gemini recommended that I talk to a doctor, and it educated me about potential conditions to discuss with them, including something I'd never heard of before called binocular vision dysfunction. The more I read, the more I felt seen in my symptoms, and I learned that even if your eyes are just slightly misaligned, your brain has to manually fuse the two images together so that you're not seeing double vision. And since vision uses 50% of our brain, that constant background task was draining my battery dry. And so, with the help of Gemini, I found a specialist, and after a few hours of testing, it turns out that I do in fact have significant binocular vision dysfunction. So what's the fix? These special glasses called prism glasses that essentially bend light before it hits your eye, effectively tricking your brain so that it can finally stop working so hard and just rest. I remember putting these glasses on for the first time, and my doctor was like, "Tell me what you're feeling." And I remember looking around the room and just feeling like, wow, the world looks so still. And I remember welling up. It was just this split-second realization that I unknowingly had just been experiencing the world different than everybody else. So it's been 2 months since I had my prism glasses, and my headaches have vanished, my energy is back. I had the right intuition. I knew it had something to do with vision, but I was focused on eye strain when I needed to be focused on eye alignment. Gemini met me where I was at. It prepared me to more effectively talk to my doctor, and that conversation with my doctor ended up being life-changing for me.
Michelle's story is a beautiful reminder of why we do the work we do. By supporting both providers and patients, we make care more accessible, and we foster a deeper patient-physician relationship. In the Gemini era, Google is defining how technology can responsibly enter the world. We're doing that with the help of some incredible research partners. For example, Amy, our conversational medical AI tool built on Gemini models, recently moved from simulated settings to assessment in a real-world workflow for a prospective feasibility study with Beth Israel Deaconess Medical Center. This testing showed that AI can handle clinical reasoning and history taking with empathy, matching physicians in diagnostic quality without requiring safety interventions by physicians. We learned AI is most effective as a tool to enhance, not replace, physicians. We also found that patients' trust in AI for clinical settings improved after interacting with Amy. We thank the team at Beth Israel for their partnership on this ambitious research project. Building on these insights, Google and Included Health are launching a nationwide randomized study to evaluate conversational AI across diverse virtual care workflows. You'll hear more on this from my colleague Yossi shortly. When the landscape of care is easier for the patient and for the practitioner, that's progress. I'm so proud of where we're headed. Now, here's Rishi to tell us about how Gemini is helping Fitbit give us more control over our health data with personalized health coach.
Hey everyone, I'm Rishi and I lead the Fitbit team. At Fitbit, we know that everyone wants to be their best, whether that means maximize your performance on the court, in the office, or at home with your family. That's why we introduced the personal health coach to public preview last fall. Built with Gemini, it's a new kind of coach that's available 24/7, backed by science, and designed to adapt to you and your health needs. Today, we want to talk about 3 big improvements we're making to the coach. So first is sleep tracking. This is fundamental to the health coach, and we've consistently been making improvements to improve its accuracy. And today, we're announcing our biggest improvement yet, starting to roll out to public preview users over the next few weeks. Trained on a diverse set of sleep profiles to ensure inclusivity, we've improved our sleep stage accuracy by 15%, a significant leap, showing significant strong alignment with gold standard clinical measurements. And our advanced AI now captures key metrics like sleep interruptions and restlessness during the night. We've also improved our nap support to make sure we capture all of your sleep. These improvements power our new sleep score to better reflect your actual recovery. And the coach is ready to help you at any point to understand, interpret, and guide you to more useful sleep. We conducted a full validation study and published a white paper on our methodology, so you can check out more in our blog post. Second, a great health coach supports you holistically across your health and wellness journeys. That's why we continue to invest deeply in advanced health research. This week, our pioneering study on predicting insulin resistance using wearable data was published in Nature. This foundational work, along with our ongoing Fitbit hypertension study, will allow the coach to use wearable data to better understand and inform your cardiometabolic health. And starting next month in public preview, you'll be able to connect a continuous glucose monitor through Health Connect. So now you can ask your coach how a specific workout or that slice of pizza impacts your glucose levels. The coach will soon bring the latest in advanced metabolic science into a personal tool for daily improvement. Now, lastly, we're announcing support for linking your medical records to the Fitbit app. Starting early next month, public preview users in the US can store and view their medical history and give access to the coach for more personalized health guidance. So let me show you. To get started, we make it really easy for patients to find their doctor or health system by searching for a name or address. Once you've found your provider, enter a few quick details, and then you can simply log into your provider's portal. And after we verify your identity, your historical and future records are synced. No more need to manually print or download PDFs. Now, it's pretty straightforward, but if you're like me, you may have records with 10 or more doctors and institutions. It's hard enough to remember them all, let alone all their username and passwords. So we're collaborating with CMS, as well as industry leaders like BeWell, Clear, and Athena Health to deliver an even better user flow in the future with a form of verified identity called IAL2. You first verify your identity with Clear by sharing a selfie and then taking a photo of a valid form of ID. Once verified, we can use that identity to try to locate your medical records automatically, so the records come to you. It removes significant barriers so you can have the easiest and most comprehensive access to your health records. Now, to enable this requires collaboration across the health ecosystem, including healthcare providers and electronic medical record companies. We hope to share more later this year in coordination with CMS. Now, with your records securely stored in Fitbit, you can use the app to quickly view information like lab results, vitals, and medications. You can see how your data has changed over time. And most importantly, you can share your records with a health coach to talk and learn more. So now when you ask the question, how can I improve my cholesterol? The coach can summarize your data and provide personalized wellness guidance and tips that are relevant to you. The coach can also provide a health summary for you and incorporate your medical history as we guide you on improving your fitness, sleep, and overall health. Now, of course, data privacy is key when it comes to medical records or any personal health data. Your records are securely stored in Fitbit, and you have control of your data, of how it's used, shared, or deleted. Your medical records, like other health data in Fitbit, are not used for ads. You can learn more on our public commitments found in our Fitbit privacy policies. Now, we want to make it easy to securely share your health data with other health apps, doctors, and health providers. For example, you can choose to share your medical records from Fitbit to Health Connect, and then enable other apps to access it. And soon, with smart health link sharing, you can securely share a health summary with doctors or family members. Just select what data you want to share, and we'll create a QR code or link. Once they click the link, they get a summary of your health. You can also add the QR code to Google Wallet for future easy, secure sharing. We think all of these are big steps to enable a more personalized health coach and help users take more control of their health data. Now, to talk more about how we're building towards a future where patients are empowered with access to their data, I'd like to welcome Amy Gleason from CMS.
Thank you, Rishi. And thank you, Google, for having me here today. In almost every part of our lives, information moves instantly. You can book a flight in seconds. You can have groceries delivered in minutes. You can even drive a ride in a self-driving Waymo without a human driver. But in healthcare, our medical records move very slowly. Patients are still filling out clipboards, faxing records, and logging into endless patient portals just to try to connect their medical history together. Sometimes it feels like the only technology healthcare is actually modernized is the fax machine. I started out my career in nursing as an ER nurse, and I saw just how dangerous it is for doctors to not have the right information, the full medical history. And then I moved into healthcare technology, where I tried to fix this exact problem to get the right data at the right time at the right place. But then I came to understand this problem very differently as a parent. My daughter Morgan has a rare disease, and when she first got sick at age 11, she was misdiagnosed for over a year. Over a year that we spent looking for an answer while she continued to get worse. And the problem was not that her doctors were not smart or not that they weren't trying very hard to find the answer, but the problem was that no one could see her full medical story together. Her data was scattered across different clinics and different systems. And so we did what many families end up doing. We became the integration layer. We carried records and we faxed documents. And we were the glue to connect the dots so that providers had the full picture. But honestly, even recently, before routine ankle surgery, we were still schlepping radiology CDs across town to different providers. In 2026, this should not be the way healthcare works. But the good news is that the technology to fix this already exists. What has been missing is alignment across the healthcare system. And so at CMS, we decided to launch the health tech ecosystem last July. And we decided to use our power to convene instead of regulation. And we asked the industry to stop putting up walls and to start working together toward a future. When we first made that call, about 60 companies, including Google, stepped forward to make a pledge to do things differently and to move faster. Today, that momentum has grown to over 700 organizations working together toward a common goal. And I'm incredibly grateful that Google stepped up early, because Google did not just make a pledge. They committed to solving two of the most critical pieces of this issue. The first is what we call kill the clipboard. Patients should not have to fill out the same forms over and over again at different doctor's offices, or log into multiple portals, or chase down their records just to get care. Instead, patients should be able to securely access their health information in an app they choose and share it in an instant. Think about boarding a flight today. You show up at the airport, scan your phone, and the system has everything it needs to know about you. The same should happen at the doctor's office. You should show up, scan your QR code, and transfer your medical record instantly. No clipboards or faxes required. But this information is not just for big moments. It's when people live with their health every single day, not just the few days a year you see their doctor. Most healthcare actually happens outside the clinic walls, at work, at home, at night, when something just doesn't quite feel right. And this is where Google's second commitment comes in. Conversational AI can be truly transformative. It starts to connect the dots. In my family, we've already seen this happen a couple of different ways. We uploaded Morgan's medical records to an AI tool, including her biopsy from 16 years ago. And it found something that was missed. What was recorded as ulcerative colitis was actually microscopic lymphocytic colitis. That wouldn't have changed her treatment over the last 16 years. But today, it means everything, because it's a little less aggressive and less risky to take her off her meds, which make her eligible for a groundbreaking clinical trial. And for the first time in over 16 years, we have real hope. Now, when Morgan is deciding to use these tools, she also connected her wearables. And this gives her an additional option. So when she's now trying to decide whether to take an as-needed medication or whether she should rest or be more active, she no longer has to guess. She can use her data, her heart rate, her sleep, her activity patterns, and her medical records to get personalized recommendations. These tools have kept her out of the ER many times. They've eased her anxiety, and they help her not feel alone at 8 o'clock when she's worried. They give her reassurance and answers anytime, day or night. But most importantly, they've given her something that patients with chronic and rare disease rarely feel: agency. I am so excited to see Google's contributions launching and the other early adopters launching their ideas and bringing them to life. But I want to be clear, this moment requires everyone. At CMS, we cannot do this without you, and you cannot do it without each other. So I'm asking everyone to stop finding reasons we can't and start finding ways that we can. This needs all of us. Today is a beautiful start. Thank you so much to Google for doing your part. And on behalf of Morgan and all of the other Morgans out there, let's build a healthcare system that finally works for patients. Thank you.
Please welcome Google Cloud's Digital Transformation Officer of Healthcare and Life Sciences, Ryan Terry.
Hello, everyone. I get the opportunity to lead the Healthcare and Life Sciences organization for Google Cloud. At Google Cloud, we recognize that while we have a great technology platform, we also understand that this truly comes only to life through our partners. As we think about that, for our organizations like CVS Health, one of our key collaborators. This means transforming infrastructure. This means enabling organizations to deliver care, improving patient outcomes. It also means reducing friction with consumers. I'm thrilled to welcome Sunny Scagliardich, the Executive Director of Strategic Products with CVS Health, Health 100, to share her latest on our strategic partnership. Thank you.
Thank you, Ryan. I'm Sunny Scagliardich. I'm filling in for Tony Ambrosi, who unfortunately ran into inclement weather and flight cancellations. He wishes he could be here. I will do my best to fill in, but let's get started. We know the best healthcare outcomes happen when patients are engaged consistently, not occasionally, but all the time across their overall health journey. The problem is patients aren't engaged consistently. And it's not because they don't care, but it's because the system makes it genuinely hard to stay engaged. We just heard from Amy and the challenges her and her family were facing as they were navigating the healthcare system. And there's so much in her experience that I think is personally relatable to each of us. It is what motivates us to drive change. Think about the data. Your health information sits across an insurer, a pharmacy benefit manager, a couple of pharmacies, a PCP, a specialist, an ER visit, maybe an urgent care visit, and suddenly your story sits across maybe 10 different entities. And the problem is none of them talk to each other well. If you want a complete picture of your health, you will be expected to manually gather it, reconcile it, and keep it updated. And when you need to seek care, you have to find somebody that's accepting new patients. How long will that take? What's covered? What will it cost? Will anyone tell me if I'm missing something important? That uncertainty creates friction. The fragmentation creates fatigue, and that fatigue drives disengagement. This is what Health 100 was meant to solve. Health 100 is a consumer-centric platform open to anyone, not just users of CVS Health. It connects benefits, pharmacies, and providers into one single experience. It puts the consumer at the center and connects the data around them. And it is designed as an open platform. We want other pharmacies, insurers, and PBMs to participate because their members' health data is more valuable when it's connected, not walled off. And members will value a partner who makes their data work and not just sit in silos. We are building this on Google Cloud's healthcare-grade infrastructure. The interoperability, the security, and critically, the AI capabilities. Google's technologies allow us to scale the connectivity and layer intelligence on top of it. Because connectivity alone isn't enough, and data without intelligence is just more healthcare homework. What Health 100 will do, powered by Google Cloud's AI, is make sense of a fragmented landscape and then do something with it. So what can you expect from us in 2026? First, a personal longitudinal health record that pulls together insurer information, pharmacy history, provider records, and wearables. It gives consumers their right to exercise access to their own data. It gives one unified picture of health. Second, we'll make sure people can find the right care at the right time, and importantly, schedule that, whether that's a physical, in-person visit, virtual, or maybe you're looking for asynchronous care so you can access care on your own time. We'll make sure that you know, what does something cost? Is it covered? That knowledge is so important. This is all powered by a digital health gateway as well that's pulling together different health providers and solutions that have been vetted, and they are curated based on an individual's specific need. Think of it as that support between visits. And behind it all, a persistent AI health partner. It's not waiting to be asked. It monitors, it anticipates, and it guides. That AI health partner will be the primary interface of Health 100. A consumer should be able to describe a symptom, ask if it's covered, and receive guidance on what that best next action is. They're not looking for a diagnosis necessarily, but they're looking for a trusted starting point. This AI will not replace clinicians. It will reduce friction, though. It will reduce fragmentation, and it will reduce the cognitive burden that is preventing people from staying engaged in their healthcare journey. Today, staying engaged in healthcare requires an extraordinary amount of effort for ordinary people. Health 100 will reverse that equation. Instead of 10 portals, one connected experience. Instead of manual homework, intelligence that is guided. And remember that uncertainty? We'll now have clarity before action. Instead of episodic support, we're going to have continuous and proactive support. That's what we're building with Google Cloud as the foundation. A simpler, more connected healthcare journey that we all can stay engaged in. Because finally, it won't be so hard to stay engaged anymore. Thank you.
The amount of medical information that we have to sift through to get to the right information for the patient is enormous. A delay of even a few minutes can change a patient's outcome, and we simply can't afford to have that happen. We all went into medicine to take care of patients, to hold their hand when they're sick. If we have to spend lots of time searching for information to take care of that child, that's time we have to spend that takes us away from why we went into medicine in the first place.
As an emergency room physician, there's a wide breadth of conditions that we treat. And it can be really difficult to be an expert on so many things that have huge implications for children's health. This is sometimes the worst day of a family's life. Being able to take that time back to sitting bedside and explaining to families what the next steps are is really valuable.
Take sepsis, for example. Giving intravenous fluids and giving intravenous antibiotics very quickly once sepsis is identified is crucial for survival. Without the pathway assistant, you may spend half an hour to an hour searching the medical literature to understand what to do. A delay of even a few minutes can change a patient's outcome, and we simply can't afford to have that happen. What we've done in the clinical effectiveness program here at Seattle Children's is distill down the most important pieces of information into a format that our clinicians can find it easily. Because Gemini has ingested our pathway content, providers can directly interact with the pathway assistant and ask whatever question they'd like. This dramatically changes the amount of search time needed to find the answer you're looking for. So we've tuned the pathway assistant to only draw from the CSW, the clinical standard work pathways. So the model gives you its response, but also shows you exactly where on the algorithm the answer is coming from. There was a moment when we were prototyping the pathway assistant that we realized that this was really working. I saw the faces of all my patients. That moment where you see the collective wisdom of the organization brought to bear in a very short time frame was pretty incredible. Using the pathway assistant, you get that information literally within seconds, which ultimately benefits the patient.
I think AI has a lot of potential to transform clinical outcomes by making sure that we are more consistent and patients are only receiving the care that they need.
It became very clear to us that we were onto something that we had to pursue with a high degree of vigor and passion, and something that we really feel can save lives around the world.
Please welcome back to the stage Dr. Michael Howell.
All right, please join me in welcoming to the stage two of the country's most innovative leaders in rural healthcare, whole person care, and clinical education, Dr. Claude Pirtle, president of the Heartland Whole Health Institute, and Dr. Sharmila Makhija, founding dean and CEO of the Alice Walton School of Medicine. I'm really excited at the collaboration we're beginning to explore together. And when we were all together down in Bentonville, you both explained the problems you're trying to tackle. And I want to bring the audience into that conversation. So can we start with that framing?
Sure, absolutely. Well, first off, Michael, thank you so much, and thank you for having us here. And we're really excited also about the collaboration. So to answer your question, we know that chronic disease accounts for about 90% of Medicare expenditures. In current state, our intents do not match our healthcare outcomes, right? Also, with healthcare spending reaching about 18% of our GDP, we have to think of a way to curb this. And unfortunately, Arkansas and many other states attribute to some of this. We're 46th in obesity, we're 44th in hypertension. We have to think about this chronic disease pandemic that we're in. Also, with our work with a number of self-insured employers, we understand that they're seeing a 6 to 11% healthcare premium increase year over year. And on the current trajectory we're on, we're going to bankrupt not just the nation, but many others. But also, we have to think of a way how we can curb these crippling healthcare costs before it's too late.
Well, thank you for inviting us today, and welcome everyone. Alice's vision for the medical school was not just about producing more doctors, but better preparing them for how we take care of them now, which isn't great, and how do we prepare them for the future. And that's focused on teaching about whole person care, as you mentioned before, looking at the whole person. And it looks like that's what we should be doing anyway, but we're not really good at that.
Yeah.
And on another step further, how do we deliver that care with more empathy? So those are the areas that we're focused on at the school.
And Alice shared with me some of her vision, and the organizations that the two of you lead are major parts of how to achieve that vision.
That's right.
Can you share a little bit about the organizations?
I would love to. So I'm Claude Pirtle, president of the Howell Health Institute, you're seeing behind me. Originally, this came about in 2019 with Alice's vision to really transform healthcare. We moved into the building above in May of 2025. The building design and architecture really does a fantastic job at really fostering well-being. So if you, in the inside, there's tons of natural abundant light, sustainable materials, also easy access to nature, trails, and other programming around well-being. But really the work inside is where we're pushing the limits of healthcare, thinking about improving outcomes, decreasing costs, and also enhancing access to care. So Heartland Whole Health Institute, we really focus in a number of different buckets. So we're working in policy and advocacy, we're working in workforce development with our sister school, and also working to build out a healthcare campus, which I'll go into a little bit more briefly. Our next big project is really our chronic disease reversal project we're kicking off in the next few months. And the goal of that project is to think upstream. So really behavior change, chronic disease reversal for people at risk and with chronic diseases, looking at how we can cure those further upstream and creating a true wrapper service, a true ecosystem around clinical behavior and also social care. So really, really excited to kick these off over the next few months.
You know, at the medical school, we opened our doors last July and welcomed our first class of 48 students, and hopefully they're watching and maybe supposed to be in class now, but that's okay. But you know, we're really excited.
This counts as class.
This counts as class. We'll count this as class. And we've just finalized the second class, and we'll be starting recruiting the third class in May. So we're really off to a great start. And as I mentioned before, we're really focused on whole person care, empathy. And how do we do that? So we've designed this curriculum with our incredible team of staff and faculty, and the students actually give us a lot of input and feedback. But we are looking at, you know, we're a traditional medical school in the rights of the foundational sciences, research, but even the clinical piece. We have clerkships during third and fourth year, but we really wanted to accelerate them being exposed in the clinical realm. And I think that's a lot based on my experience of having to retrain residents and faculty. No fault of theirs, but we didn't better prepare them for how do you actually apply what you learned in a clinical setting. So we've accelerated, you know, they're in the classroom, they're practicing in simulation, and then they are in a early clinical experience within the first couple of months. And what we love is that we're working with our educational partners at Mercy, and those doctors that are teaching in the lecture rooms and the halls are actually in the clinics with them. And I think that's probably one of the most favorite parts for our students. And on top of that, since we're sitting on the campus of a world-class museum, Crystal Bridges, if you haven't visited, please come visit. We're using those educators that are teaching grade school kids about how to look at art and improving their learning, their listening skills, their empathy skills. And they are fully integrated into our curriculum. We have Embracing Whole Health. That's front and center all throughout the 4 years. And then we have a health system science track, because I'm pretty practical, and I think that it's very important that physicians are prepared and these students are prepared to practice so they understand about the infrastructures, finances, that bad word finances that people don't like to talk about, but it's the reality. You have to understand how to manage a practice, and technology. And that's where we're so excited to work with you, because it's really important to give them the foundations and how to build on that.
Yeah, and one of the things I love that comes out in both of your descriptions is this intersection of people, place, and technology to improve both outcomes and clinical education. Can you talk a little bit about how you see technology playing into that mission?
Yes, so you know, we're building out a healthcare campus, and you can see the sketch, the renditions behind us. And Claude will go into more details about the details of the campus. But what we want to do, of course, since I'm focused on the education piece, it's not just about medical students. It's looking at the whole workforce development. And how do we better prepare them to work now and for the future, just like we're doing for the students. So, through the generosity of Alice, she has taken a very good model of a high school, similar to a medical high school, that's actually going to be amplified on the campus, building out. They're going to be situated there. We have a STEM university that the family has invested in, looking at all those areas that we need in the healthcare workforce. How do we accelerate their learnings to go faster and more appropriate for what we're going to see for the future? We've got our students, we've got residency programs, but that whole piece, that's another piece that we're excited about working with you about, building out those platforms, accelerating the learnings to get prepared for the future.
Amazing.
Yeah.
To the Dean's point, so Bentonville Healthcare Campus, as you can see here, is a 110-acre campus. We're just beginning to design with our first building opening in 2029. Really, the goal here is specialty care and allowing world-class care to happen, not just there, but also from afar, and promoting wellness and also health. So how will this campus really affect transformation of healthcare? There's a few different mechanisms. You can think about focusing on whole health principles, also advanced technologies, workforce development, as we talked a little bit about, but really also alternative payment models. We want to use this campus as a piloting site, once again, to think about how do we swing that pendulum from reactive fee-for-service care back towards preventative care and value-based care. And with that comes technology. So technology, we're using them as the newest member of the team, if you will, right? So as you can imagine, it's everywhere. It's really indicative of how do we do things now. So the hub and spoke model of the campus, how do we democratize that same access so that your zip code no longer dictates what type of care you're able to receive? So you can imagine AI. You can also think about AR, other telehealth opportunities, and remote patient monitoring. We're really trying to redesign how we think about care in those rural areas specifically. Because a one-size-fits-all approach is no longer appropriate. Patients want to receive care how they want it, when they want it, and in what intensity. And we're trying to do that. And technology is going to be key to doing that appropriately. And that's where Google, we think, could really, really help out a lot.
And healthcare is a team sport, and thinking about technology as a new team member is a really interesting thing for us to all grapple with.
Right.
Listen, I'm so excited about the work that you all are doing to bring Alice's vision to life. I have such confidence that it's going to be good for the people of Arkansas, good for the country, and good for the world. And we're excited to get to explore this together.
Yes.
Okay, lightning round, quick answer. Tell me one reason that you're optimistic about the future of health.
Well, I'll start. I'm a realist and an optimist. So I heard your comments earlier. I totally relate to that. Yeah. It's, incredibly optimistic, even though when we're struggling with things that are happening in healthcare, that's the way you maximize the opportunities for change. And so with technology on the forefront of how we actually improve healthcare, I want us to not forget about that human connection. Yeah. And so we're really focused on the empathy piece because that's going to be even more important.
Amazing.
Yeah.
I love that. And I also agree, optimistic here, very much so in healthcare. I haven't seen such momentum around preventative care, whole health care, really the foundation of health issues. So thinking nutrition, mental health, environmental. And I think I'm really excited for the journey to come, and I'm just happy to be a part of it.
Yeah.
Amazing. Listen, thank you for joining us.
Thank you.
We're really grateful.
Thank you.
Please welcome Global Head of YouTube Health, Dr. Garth Graham.
Hey everyone, it's really great to be back here with you all. Garth Graham, and I am a cardiologist, and I lead what we're doing with health at YouTube. As I start off by saying, it's really cool to be back in this room with all of you here. I gotta say the Jamaican in me is a little bit at odds with the 36-degree weather outside again. But putting all that aside, there's a lot of warmth in this room, and hopefully you're feeling the energy in terms of the cross-Google leadership that is changing the world from patient to patient, but thinking about how we operate at scale. And that's really what's inspirational about the work that we do. We take it from the individual all the way to look at how we can change things across the globe. At YouTube, we are dedicated to making high-quality health information accessible to everyone, everywhere, and doing this, like I said, from the individual level at scale. We also recognize the critical importance of moving from knowledge to action. The shortfall of healthcare workers that you heard Joel mention earlier, that's not just happening in Japan, that's happening across the world. The World Economic Forum projects that we're going to have a global shortfall of around 10 million healthcare workers by 2030. The biggest driver of this, we think, is both a lack of investment in education and also training. The good news from our standpoint is that we think we can be part of the solution in terms of solving that. With nearly half of the world's healthcare workers already turning to our platform, YouTube, for clinical content, looking at things from how to study from exams to how to ligate your right coronary artery, we know that people are coming to our platform for information on a day-to-day basis. So we think we can address this shortfall by using AI to transform passive watching into active learning. Over this last year, we've continued to expand access to our conversational AI tool on YouTube to more and more users. We're constantly updating this experience to make the tool faster, smarter, but more importantly, safer. And now we're beginning to see how these advancements can be applied to health. This means that on eligible health videos, you'll see this Ask button, giving you direct access to an AI tool that is based on the video's content. And that allows you to turn watching into this really interactive conversation. It's going to do amazing things for learning. This represents a fundamental shift in how we learn. It allows users to interact with health information in a way that's more individualized, so that they can engage with it at their own speed and travel at their own level of understanding. Now, folks, imagine start to think through some of these possibilities. Whether you're a student first entering into the field or a practicing doctor, this feature helps kind of meet your learning needs on an individual basis. A busy community health worker can now ask for specific detail from a 20-minute lecture and immediately get a time-stamped response, saving time and allowing them to focus on the specific topics they need to understand more. If you're a first-year medical student and you're trying to understand these complicated concepts, you can say in a simple way, you can ask the Ask tool to help translate all of this terminology in the video into language that you can understand and then share that with your colleagues and your community. As we continue to update this experience for more users, you can even ask the tool to quiz you, which is amazing. It will generate multiple choice questions based on the video, helping you test your own knowledge of the content while you're watching it. So this shows you how, as you're interacting, you're learning, it's really transforming your own personal experience and really reinforcing the information as you're getting it. By democratizing access to the world's health experts and leveraging AI tools, we move one step closer to accelerating and scaling healthcare workforce training. This is vital because the scale of the need is already clear. As of December 2024, YouTube crossed 1 trillion views on health videos globally. We went from millions to billions to trillions. That's how we're operating at scale. That's how we're changing the world. And that's what we want to do in terms of health education. By meeting this massive demand with smarter tools, we're improving overall health literacy for everyone, everywhere. We're bringing these possibilities to life through exciting partnerships with a lot of you here in this room, and it's really cool to see a lot of our partners. And in particular, as we look around the globe, one example, we're partnering with the College of Nursing at the All India Institute of Medical Sciences, AIIMS in India. And they're using YouTube to bring professional nursing education, bring professional nurses courses in terms of advancing nursing education. So they're using YouTube for mandatory courses like hospital infection control. And this is now available to students and practicing nurses across the country. But we didn't just want to host the content, we want to transform how students engage with it. With conversational AI, nursing students can spend less time kind of scrubbing through a video and more time actually understanding it. It enables this concept that our team really loves, which is just-in-time learning. This allows students to get immediate answers to questions they might not ask in the traditional academic setting as they're learning. This isn't just thinking about technical competence. It's about building the confidence needed to master dense, complex medical topics. Our colleague, Dr. Latha, who runs the program, nursing program at Ames, she really captured this impact. And you really have to listen to her words. She says, "What excites me most is the tool's power to convert passive viewing into active learning. In resource variable settings, the ability to clear doubts in real time really builds the critical thinking and self-directed learning essential for competent nursing practice." Much like Ames, we're working with the International Federation of Red Cross, the Red Crescent Societies, IFRC, to use this to augment and scale just-in-time learning for first responders, which is so cool. As we host workshops with National Red Cross Societies starting in Latin America, we're also exploring how to redesign their digital courses to effectively use this conversational AI tool. Listen to how Lois, one of their leaders, explained this. This first comment: clarity saves lives. By leveraging generative AI, we can scale life-saving knowledge across communities in the Americas and beyond and move faster than ever before. This technology ensures our volunteers have the tools to turn knowledge into actions, into moments that matter the most. So as I think through and as I wrap up today, I hope you see a common thread across all these examples. From students to nurses to first responders, we're one step closer to meeting learners, everyday learners, where they are. That's how we work to close the gap in the healthcare workforce and improve health literacy across the world for everyone. Thank you, guys.
Taiwan is constantly striving to be the best healthcare system in the world. In the 2025 Nobel Index, we ranked the #1 globally.
Taiwan is very special because we have public insurance systems. The National Health Insurance Administration, they cover 99% our citizens' health information.
This data should do more than just process the payments. It should be used to predict and prevent the chronic disease. With over 10% of our people living with type 2 diabetes, the burden on our healthcare system is simply too heavy.
Diabetes is a chronic disease not only treated by medications. Behavior changing is more critical issues. Our clinical service is more focused on disease treatment. So technology is a very good way to change people and patients' behaviors. That's why the AI on DN is created. Comparing with before, we will spend more than 1 hour collecting their diagnosis information. And now, using AI, we can decrease to maybe 20 seconds. We can evaluate what is the level, including generated the personal report, maybe 100 times more efficiency for those professionals.
With Google's Gemini AI, we can finally understand the disease progression, not just for the population, but for every individual. The real game changer here is personalization. We are moving away from one-size-fits-all model and towards a future where healthcare is tailored to the specific needs of every citizen. AI on DM is going to truly transform healthcare in Taiwan. It's not just about the technology. It's about giving people the tools they need to drive the behavior change and improve their lives.
Actually, for us, we are so exciting because we spent over 15 years to make it real. We can also understand their health behavior is changing and their lives become better.
By partnering with Google, we are moving beyond standard treatments. We are offering personal insights, health recommendations tailored to each individual, encouraging healthier choices and more effective care. This is how we build a healthy Taiwan, one personalized insight at a time.
Please welcome VP and Head of Google Research, Yossi Matias.
Hi everyone, I'm Yossi. I'm leading Google Research. Foundational research is our core, and it is through deep collaborative partnerships that we truly can actually take this research and make the impact that we can. So I'm really happy to welcome on stage one of our innovative Google partners, Chris Bacon, Head of Computational Science R&D Roche Diagnostics. Hey, Chris.
Hi.
Great to have you here. Our research, our collaboration with Roche has been going on now for over a decade on bringing research on genomics to reality. So really looking forward to hear more from Chris. Take it away.
Thank you. Hi, everyone. Thank you for having me here today. I'm Chris. Roche has been innovating for over 125 years with a single guiding vision and purpose: doing now what patients need next. To understand why innovation and R&D work is so vital in healthcare, I'd like to bring you into the world of oncology research and testing. Now, everyone knows someone whose lives are impacted by cancer. Even young people are being diagnosed and losing their battle every day. In many cases, these could have been prevented, or quality of life could have been improved with timely detection and appropriate treatment. This is where sequencing comes in, because cancer is a disease of genetics. Our goal is to offer cost-effective and fast solutions to achieve larger and faster oncology research and over time improve healthcare and patient outcomes. Let's take liquid biopsy. This is a type of blood-based test that can help detect cancer much earlier. One major challenge with liquid biopsy-based testing is the turnaround time required to get results is quite long, many days to weeks, even in an optimized research and test lab setting. And costs to run these type of tests are high due to the depth of sequencing required to reach a very high level of accuracy and sensitivity. Roche recently introduced SBX sequencing technology, which has the potential to help cancer medical research and oncology labs address these challenges. Our goal is to offer fast, cost-effective solutions to reach larger and faster oncology research and over time improve healthcare. Recently, the SBX technology sequenced a complete whole genome in less than 4 hours, significantly surpassing the previous record. For comparison, the first complete sequencing of the human genome took approximately 13 years and cost around $3 billion. Today with SBX, it can be done in just a few hours for less than $150. In the future, rapid whole genome sequencing can be crucial for cancer patients. Speed can literally save lives. Together with Google Research and cloud teams, we are pushing the limits of what is possible. As you can imagine, the computational power required to comb through the human genome with the speed and accuracy is an immense challenge. We also can't just throw raw processing power at the problem. We need a platform that allows us to build highly accurate analysis methods in an environment that's as nimble as the science is complex. By benchmarking Google TPU-based stacks for training and by leveraging AI-based methods such as Google's Deep Variant, we're improving the accuracy and performance of our genomics AI methods beyond what was previously possible. We have moved beyond just processing data. We are building a world-class genomics research technology stack using the Google Cloud. For over a decade, Roche and Google Cloud have worked side by side to optimize our genomics research platform. And together, our teams are refining the computational logic and research workloads required to accelerate advanced genomics. Ultimately, this allows us to bring these advances into medical research and eventually clinical use, partnering with labs to turn raw data into actionable insights. We are excited to continue our partnership with Google, driving the next wave of innovation with AI-powered genomics research. Thank you again for the time, and I can't wait for what we can do together for the next decade.
Thank you, Chris. Really inspiring to see the work and how research is moving to reality, and looking forward to continued collaboration. So I've been at Google for nearly 2 decades, actually much of it in search leadership, and now I'm heading Google Research. My personal passion is really both about deep research as well as product innovation and impact. But mostly I'm excited about the interplay between them. When you think about how to take research questions that are motivated by their potential to make a difference, think about it as intentional curiosity. Then taking a research breakthrough and moving it all the way to reality, which then to real-world impact, which then actually generates the next research question. I like to think about it as the magic cycle of research, from scientific breakthrough into impact on products, on science, on society. And today, that magic cycle is accelerating faster than ever. It applies to a broader sequence of opportunities than ever can be considered. Really, previously unmanageable solutions to problems. Now, it's incredible to see how much we've progressed since I stood here on this stage last year. From conversational medical AI and our co-scientist multi-agent system, to MedGemma, to personalized health, to public health using our Earth AI. Now, the milestones we heard today from search, Fitbit, YouTube, they are all grounded by research breakthroughs. So I'd like to share a few highlights of progress done in research and its impact to reality. This is about work done by teams across Google. One of our most legacy works, you've heard about it before, is our work on diabetic retinopathy. From a legacy paper back in 2016, a decade ago, to moving to the clinics. By now, we had over 1 million screenings of people helping prevent blindness. Now, with the generative AI revolution, we've been looking into how can we make our large language models better for healthcare. Looking back into a few years ago, our MedPalm work, which was published in Nature, showing for the first time a model that could actually answer US-style medical exams in a passing score. And a lot of progress over the years on many areas. So let me start by first highlighting MedGemma, our most capable open model. Now, to truly accelerate progress in healthcare, we must empower the global community. That's why we offer a suite of foundational, open and lightweight medical models that everybody can actually use, researchers, application developers, organizations. This includes MedGemma, our collection of open medical text and image interpretation model. MedGemma has transformed from a theoretical research into the clinical world. It's a building block for many applications, for many researchers that can build on these open models. Now, we only made it public last year in May, and since then we already had more than 3 million downloads with thousands of applications based on that. For example, AIMS New Delhi is using MedGemma to develop applications for outpatient triage for dermatology screening. Now, increasingly, AI is not just answers questions, but actually true collaborator, especially with conversational AI experience, and especially with the rise of agentic capabilities. Now, what began with AIMI foundational papers and simulated medical interviews with rigorous research published in Nature evolved and progressed into real-world, single-center clinical feasibility study with Beth Israel. We just announced it last week. And we'll soon launch the first of its kind nationwide randomized study with Included Health to evaluate conversational AI virtual care at scale. We're also seeing growing number of impactful use cases with our co-scientist, multi-agent research collaborator. This is really exciting area of research because it's about AI accelerating scientific discovery itself, perhaps the biggest potential of all. For example, our scientific partners in Imperial College London working on antimicrobial resistance found that the system generated a hypothesis in just a few days, the same hypothesis that took previously years to actually come up with. In the fight against cancer, we just released the results of a pair of rigorous studies with UK's NHS and Imperial College London, looking to see how to actually use mammography in the field. This was published in Nature Cancer. We're seeing very promising results. Research found that AI can detect 25% of breast cancers missed by human specialists, and is capable of safely reducing 40% of workload of screening of specialists, which may also translate to faster reporting time. We're also released Dipsomatic, an open source tool to help identify generic variants in cancer cells. This really comes after a decade-long research in genomics, and we've heard about some of the impact on that with DeepVariant, Deep Consensus, and others. Cell-to-sentence scale is our 27 billion parameter open model built with Yale to helping understand single-cell behavior, which recently generated an entirely new hypothesis about how cancer cells behave. Now, our vision really spans from the cellular level all the way to the planetary level. Recently, we announced Earth AI, a collection of geospatial models, bringing together all the models that we've been using in the past, building in the past, along with AI agentic layer for planetary intelligence. Earth AI is already helpful in crisis resilience, in business logistics understanding, and importantly, it opens up an opportunity to actually transform public health. By taking localized health information along with planetary insights, we can actually shift public health from reactive to proactive to help predict outbreaks, identify local vulnerabilities, and deliver proactive care where it is needed most. Now, Earth AI is already in use by partners worldwide, and we're seeing publications based on this kind of public health on Earth AI. As an example, researchers from Harvard, Mount Sinai, and Boston Children's Hospital were using it and published a paper about how they can understand vaccinations of measles in the US in the zip code level. We're really in the midst of a profound transformation towards a truly personalized medicine. And as we make these advancements, as we're driving research, as we're moving it to reality, the scientific method is more important than ever. The rigor of verifying, investigating, publishing, sharing, iterating on that. Now, part of the work that we're doing at Google Research is really, and across all teams at Google, is really about the art of the possible. It's really about how to look around the corner, to see what's possible in the future. One thing that I'm very excited about is the possibility of AI to amplify human capacity. But even more so, the potential of AI to amplify human ingenuity, to empower the patient, the doctor, the healthcare worker, the lab worker, the scientist, the students. This potential is greater than ever, which makes me really optimistic about the bright future that we have on making healthcare better than we've ever seen it. Thank you very much.
Thank you for spending some time with us. At the beginning of today, I told you that I was optimistic, and I hope now you see why. It's no longer just a question about the future. It's about help for today and hope for tomorrow. A new era of discovery has arrived, and it's in your hands. It's in all of our hands. On behalf of everyone who works on health across Google, thank you for joining us at the Checkup 2026. And so